Perfect. Would you like me to help you with your back pain? Yes, ma'am. You can call me Catherine.
Catherine, these are like what I've got. So these are the ones you ain't know. This is the stack of those. These are the stack of the 5 poses. And then this has both these postures. And
right.
On the back it has your classes.
Great,
so,
thank you.
Yeah, I have all those.
Okay, great.
So.
And the list of the exercises?
Those are the 5 poses.
Yeah.
Is that it?
Yeah. Right.
Okay. And then what I'll do is we'll start and I'll record it.
Okay.
Once I get it finished uploading the session, but again, I'll give you the floor. Like if you want to use the whiteboard for anything or whatever, feel free. And then at 8:30, if you want, we can go upstairs for the class.
Okay, that's great.
Yeah.
And what was your name?
Deanna.
Deanna.
Yeah.
Okay, great. Thank you. And does anyone else have any back pain?
I used to, but.
Not anymore. Okay, good. All right. Well, Deanna will be my
Guinea pig, yeah,
guinea
absolutely.
pig.
Sure. Anything you
Absolutely.
need, let me know. Yeah, but I guess we got a small class today. So this is Catherine Carrigan, and I'll go ahead and introduce everybody here. I got Josie, Nina, Deanna, and Tanisha, and then Taryn. So again, it might be a little small, intimate crowd, but let me know if you need anything. She's got some handouts, and she's wonderful. She's a medical intuitive healer. By the way, she's a #1 bestseller on Amazon as well. So we're going to learn a lot from her today with energy and, again, just back pain. She's helped me thoroughly, just in a small amount of time I've known her. But I'll go ahead and give you the floor, Catherine.
Okay. Good morning, everybody. All right, so let's start by getting some handouts, and if you'll take one and pass it. Okay. And then take one and pass it. And then take one and pass it. And so my name is Catherine Carrigan. This is my 21st year teaching yoga, and I'm going to be teaching you all how to get rid of back pain using yoga. So there's been a lot of studies that have been recently reported about how yoga is more effective for treating back pain than traditional therapies. So that's what I'm going to be teaching you guys this morning. And so we have Deanna, who has agreed to be our wonderful demo model. So Deanna, would you like to come to the front and be with me? Sure. Okay, so Deanna is very kind. Now, I'm very blessed in that I get to work out of my house doing therapeutic work. And I have the life that I've always wanted, and that many people say they want. So when you do what I do, you have to give people the truth or you don't stay in business. So the information that I'm giving you is based on my 21 years working with people with all kinds of pain. Thank you so much. And the first thing that I'm going to do whenever I'm working with anybody who's got back pain or shoulder pain or neck pain is I work with them on their posture. And because you can get someone out of pain just by changing their posture. And a lot of us know that good posture is a good idea, but we don't really even know what good posture is. So the first thing to ask is, Deanna, on a scale of 0 to 10, with 0 being no pain, what's your pain level right now in this moment?
Oh, like around like a 2 or 3.
2, okay, 2 or 3, low level. Okay, now I want everybody, and is it okay if we look at you?
Yeah, that's fine.
Okay, so everybody, I want you to just take a look at the way that she's standing, okay? Now, I'm going to make a couple of comments about your posture, and just know that this has nothing to do with your beauty or your intelligence, but it's just that most people don't know how to stand properly. And I'm going to use some training wheels, and I'm going to be using some yoga eggs to teach you how to stand properly. And I'm going to get, why don't you stand like right there so you can right be in the middle for the camera. And the first thing I'm going to do, this is a yoga egg, is I want you to put the yoga egg on between your feet. Put the yoga egg between your feet. All right, now hug the egg with your feet, okay? Now the first thing is that whatever your feet do is what your hip is doing. And whatever your hip is doing is what your knee is doing. And then the legs extend the spine. So I'm going to be teaching you all, so repeat after me. My feet.
My feet.
Control my hips.
Control my hips.
My hips.
My hips.
Control my knees.
Control my knees.
My legs extend the spine.
My legs extend the spine.
Okay, some handouts if you just joined us. And a long time ago I went to college, so I remember what it's like to be asleep. I think I always did basketball classes that started at 10 a.m. So, yeah, grab that. Okay, so again, repeat after me. My feet control my hips.
My feet control my hips.
My hips control my knees.
My hips control my knees.
My legs extend the spine.
My legs extend the spine.
Okay, so once you understand that, if you have hip problems, what do you need to fix? Your feet. Y'all are smart. And you're waking up. And if you have knee problems, what do you need to fix? And if you have back problems, what do you need to fix? Your legs. Legs. But it all begins with your feet. Okay, everything begins with your feet. So I want you to, and see even now where your left foot is turned out, I want you to have your foot straight ahead. Okay, now from right where you are, we've got right here. So the center of your pants is your seam. I want you to pull your inner groins back slightly, and you're dressed perfectly for what we need to do. So just pull your inner groins back towards the center of you, and to help you do that, I'm going to give you another training wheel. So bring your legs apart a little bit, and put that between here, and just pull that back. Okay, so pull your inner groins back. Okay, now notice if you're looking at me, I'm not locking my knees up. And the way you were standing before it, I'm going to imitate you. You were like this slightly. Okay, so by turning your feet out, her hips are rotated out and her pelvis was thrust forward. So I already know that without even testing her that she's got problems with her SI joint, which is perfect because I need to teach you how to do that. So you're going to pull your inner groins back, and then from 2 inches below the belly button, you're going to lift that up towards the crown of the head. Okay? And then I want you to press your shoulders back into my hands. Okay? Now I want you to keep breathing just like that. Now, when you started, your pain level was a 2 or 3. So just by standing right now, what's your pain level now? Okay, you're at a 0.
Yeah.
Okay. So what you just learned is that if your back hurts, your posture's not correct. You feel me?
Yeah.
All right, so I'm going to lend everybody a yoga egg. Everybody just take one yoga egg out of here. You're going to borrow a yoga egg. And I'm going to teach everybody how to stand up properly. And you keep practicing. Okay? So take a yoga egg, and then go ahead and stand up. And we're all going to learn how to stand up properly. So this is the foundation of my work, because I can give people brilliant exercises, but if you don't know how to stand or sit properly, you're going to be in pain. So take a yoga egg, and just like Tiana, I want you to put the yoga egg between your feet. Okay, and anybody else have back pain this morning? Yeah. Was that not today?
Not today.
All right, so put the yoga egg between your feet and hug the egg with your feet. Okay? Now I'm going to stand sideways to you all. Now the seam of your pants, what I want you to do is just pull that back to the center of you. And then from 2 inches below the belly button, lift that up to the crown of the head. And then I want you to press your shoulders back into an imaginary wall. And breathe. See if you can continue to breathe. Okay, now, while we're standing properly, I want everybody to make some comments about how they feel. Okay? How do you feel when standing up straight? You feel your abdomen stretch. Okay, great. Taryn, how do you feel?
like she just said, Elena is right. Like for me, I usually stand like this. My students will notice that I try to stand this way, but I feel much better though, like out of pain.
Okay.
Anatomically correct.
Anatomically correct. Okay. How do you feel?
I'm a little uncomfortable.
A little uncomfortable? Yeah, because it's a lot, it may be easier to just, right? It takes a little bit of effort to do this, but over time, you're gonna have less pain, right? Okay, now, okay, thank you so much. All right, now go ahead and keep your yoga egg, because for now, I may have y'all use it again. So now I'm gonna teach Gianna how to sit properly. And because again, what we're working on, we're learning how to do yoga to get out of pain. Now I'm gonna, you can keep practicing, okay? All right, because again, most people stand like this, right? And can you see how, if I'm standing like this, can you see how my lungs are gonna collapse? Now, if my lungs collapse, I'm not gonna be able to get a full breath. And if I can't have a full breath, then that's going to affect my energy level, right? Now, now you may not like this person, but have you ever seen any photographs of Melania Trump?
Yes.
Yes. Okay, she has beautiful posture. Okay, or Beyonce, or any of the models. If you watch them, they're not standing like this. Okay, when you want to look fabulous, you get your feet under your hips. You lift from 2 inches below the belly button, and then you press your shoulders back in an imaginary wall. And you can see when I stand this way, I'm kind of looking a little better. Okay, same person. Okay? All right, now the way that most people sit, I'll show you the way most people sit. Okay, and can you see how my back is kind of a C curve? Now, I'm going to start with my pelvis, because this is what's called retroversion of the pelvis, which means that my hip bones are rotated back. Can you see that? And when this happens, I'm putting pressure on my lower back. Okay, now, so far in this class, only one person has back pain, but raise your hand if you have family members who have back pain. Okay? All right, yeah, almost everybody in the room. So I want you to listen carefully to what I'm telling you, because you could go home and you could make a huge difference in somebody's life. So the first thing you want to do is teach people how to stand up straight. And one of the handouts that you received this morning teaches people how to stand up straight. And what I'm going to do is on the handouts, I'm going to put them in the front right here. And if you came in late, just come and grab one. Okay? All right, so the next thing we're going to do is we're going to teach Miss Diana how to sit properly. Okay, so take your yoga eggs with you. And, okay, so go ahead and sit in the chair. And I want you to sit the way you usually sit. Okay, so let's all look at Diana the way she usually sits. Now, everybody, put your hands on your hip bones right here. These are your hip bones. Now, when you're sitting properly, your hip bones should be rotated forward slightly. Okay, now the way that most people sit is they sit with what's called retroversion of the pelvis, where their hip bones are going back. Okay, now I want you to sit. First of all, you're gonna, and I'm a woman, I talk about my body, so I'm gonna take my ass and I'm gonna defluff my pillows. So just, we're all sitting, y'all are sitting, so just defluff your pillows. So just pull the flesh out from underneath you so that you feel your sit bones. Feel yourself sitting on your sit bones. Okay, so, and already you're sitting better, right?
Yeah.
So pull the flesh out. Does everybody feel your sit bones? Okay, now get your hip bones forward. Okay, now we're going to use Diana's. Okay, put the yoga egg between your feet again. Hug the feet. Hug the egg with the feet. And then come forward a little bit on the chair, a little bit, just to show you for demonstration purposes. Put that here. Okay, now, all right, now from 2 inches below the belly button, lift that up to the crown of the head. Okay, and then you're going to pull the shoulders back. Okay, Now, let's look at Deanna, and how does she look now? Is she sitting up straight? Yes. Okay, now, those of you who have a yoga egg, put it between your feet. If you just came in and you don't have a yoga egg, raise your hand and there's plenty one. Okay, and what I want you to do is I want you to practice sitting properly. Because again, even if you don't have low back pain, you're going to have family members who have back pain. Anybody, does everybody have a yoga egg? So you defluff the pillows. You're sitting on your sit bones. Borrow this. A long time ago, in another lifetime, I went to college. I can remember. Okay. All right. So you've got your yoga egg between your feet. You're lifting from 2 inches below the belly button. That's the pit of the abdomen. And then you're pushing your shoulders back slightly. Okay? And do you notice how by sitting this way you can actually breathe better? When your lungs are expanded, you can breathe better and you're going to have more energy. Okay, so do you have any pain right now?
In my back, no.
Okay, all right. So by definition, if your back hurts, then you're not in good posture. Does that make sense? And so if you learn what good posture is, then when you're uncomfortable, the first thing you want to do is just get your body in alignment. And the definition of good posture is the place in which you're most biomechanically efficient. Okay, so if I'm working with somebody in back pain, the first thing I do is teach you how to stand and how to sit. Okay, because if you're not standing or sitting properly, you're going to cause yourself back pain. Okay, so before we move on, does anybody have any questions about how you should stand? No? Okay. Does anybody have any questions about how you need to sit? Yes.
I always wear my wallet in my back pocket.
Always wear your wallet in your back pocket.
Yeah. Is that not good for sitting? I always was wondering.
Not good for sitting.
Right.
That's a really good question. Because if you, and I'm going to, yeah, go ahead and stand up. Thank you. Thank you. And just stay up here. You're going to work. So the issue is if I've got a wallet in my, does anybody else put their wallet in their back pocket? Yeah. Okay, so what happens is if you have a wallet in your back pocket, then one hip is going to be elevated. Okay, and you're going to throw everything out. Now, so watch this. Okay. Everybody leave your egg on the floor, and I want you to cross your right leg over the left. Cross your right leg over the left. Okay, now, with your right leg crossed over the left, I want you to feel what's happening in your lower back. Now, you may not know, does anybody know your muscles?
Yes.
Kara does. Okay, do you know your quadratus lumborum muscle?
Yes.
You know what that is? So when you cross your one leg over the other, okay, your quadratus lumborum muscles are going to be out of balance. Can you see that? Mm-hmm. So this side's going to be longer and that side's going to be shorter. So if you are working with somebody who has chronic back pain, one of the things you need to tell them is do not cross one leg over the other. Now you all are all young. I remember that. It was a while ago. So again, I'm going to sit down. I'm going to defluff the pillows. I'm going to sit with my hip bones forward. And your lumbar curve should be 30 to 35 degrees. I've got a 90-degree angle in my feet. I'm lifting from 2 inches below the belly button, and then I'm pressing my shoulders back. And if you have posture handout, it shows you how to sit properly. Okay? And the middle of my ear should be lined up with the middle of my shoulder, which should be lined up with the middle of my hip. So if you really want to cross something, has anybody ever seen any pictures of the Queen of England? If you want to sit properly, you want to cross your ankles like the Queen. Okay, so just sit there and just cross your ankles. Okay? So and even if your back doesn't hurt now, because how old are y'all? 20? 21. Okay. So one day you may have back pain. So when your back hurts, you want to sit or stand properly. And the first thing that you need to do when you're working with somebody who has back pain, you have to create length and space. Okay, because when they have back pain, there's going to be compression. Somewhere along the line, the vertebrae are going to compress. So you're sitting with your ankles crossed like that. Okay, so if you have to cross something, cross the ankles so that your pelvis can be even. Okay, so any more questions about how to sit or stand? No? Okay, now I'm going to draw on the board. And Deanna has shared with me, and Deanna has very graciously agreed to be our demo model. And she has shared with me that she has low back pain. This is very, very common. So everybody take your right hand out and bring your fingers together like that. So your lower back has 5 lumbar vertebrae. Your lower back is the width of one of your hands. Now this area in your spine supports 2/3 of your body weight. Okay, so let's say for just ease's sake, let's say you weigh 150 pounds. How much weight is on this area of your back? If this area supports 2/3 of your body weight and you weigh 150 pounds, 100 pounds. So this area is going to take 2/3 of the pressure of my weight. Okay, so this area in your body does a lot of work. So here's my lumbar vertebrae. That's the width of my lumbar vertebrae, and then right here is what's called my sacroiliac joint. Now you have a sacrum, which is these large bones right here, and this area right here, this joint, your sacroiliac joint, it's a major joint. And again, if 2/3 of my body weight is here, all the pressure is here from gravity, right? So if I'm working with somebody with back pain, the first thing I teach them how to do is how to stand, how to sit, and then I'm going to check their sacroiliac joint. So you're doing a great job. Now come up here, and I want you to turn around so that everybody can see. Okay, and I'm going to touch you. Right, so here, right here, this is her lumbar spine. Okay, now she was in my office. I have a little compass where I actually measure the lumbar curvature. Because if your lumbar curvature is less than 30 degrees, then there's going to be, if your lower back is too flat, there can be compression. And those vertebrae are going to squish together. Now, as you know, you've got bones and you have nerves. So the nerves that go to the organs in your body in this area include the nerves that run your digestive system, all your sex organs, your kidneys, your prostate, your ureters, your ovaries, your testes, all that stuff.
It's all in there?
It's all right there. Exactly. So you have to think of it as kind of like a lamp. If the lamp gets unplugged, it doesn't work. So the nerves that make those organs function are all right there. So if there's compression, that can affect the functioning of your digestive system, of your urinary system, of your sexual system. So very important. So we're going to be looking at right here. Now I'm gonna test this, and the way I'm going to test her sacroiliac joint is that I'm going to put my thumbs like this on her 5th lumbar vertebrae right here. Does everybody see that? Okay, and I'm going to go to the side just so y'all can see. Or maybe I should go here. Can y'all see? Okay, now Deanna, do me a favor, and I want you to lift your right knee up towards the ceiling. Lift your right knee up. Okay, good. Lower down, just like I thought. And then lift the left knee up. Okay, so lower down. Okay, now the reason, and I could tell when you're highly trained at something, you can just look at somebody and know what's wrong with them. So when she came in the room, she stood like this. Her feet are turned out, so I knew her hip bones were turned out, and she had her pelvis thrust forward, and it was locking up her SI joint. So just by having her stand properly, then she got out of pain. Deanna's sacroiliac joint is completely locked. Now the reason I know that, in a minute I'm going to have you check each other, is you put to check the function of your SI joint, you put your thumbs on the junction between the 5th lumbar vertebrae on L5 and S1. Now when it's healthy and normal, and she lifts the knee up, then the thumb should move. Okay, now you're gonna test me, so move out of the way. Now, I'm normal in this area, I think, okay? So what you're gonna do, Deanna, is I want you to put your thumbs right there. Okay, so right there. Okay, so, and now I'm gonna lift my knee up. What happened? It moved a little, okay? Sure. Yeah. Okay, and it's slight, right? It was slight. Now, did everybody see that? So do you mind, get down on your mat. You want me to give you a yoga mat?
I don't know.
Okay, here. I don't want you to hurt your knees. There you go. So just kneel on that sweet height, just so they can see. Okay, so because I want you to see what a normal sacroiliac joint looks like. Okay, I've got the me. Okay, can you see that? Did everybody see my SI joint move? See that?
Yeah.
Okay, now I want you to test each other. And you don't have to kneel, so just get with a partner real quick, the person next to you. Okay, go ahead and stand up. Yes. Let me talk to you after class, is that okay? So everybody, that's a really good question. So everybody get your partner, get a partner, okay? And you're going to put your thumbs on the fifth lumbar vertebra, and you're going to have the person lift the knee up. Okay, so she's normal. Okay. I'm sorry. Just like that. Okay. Did you feel that? See that move?
Yeah, like very slight.
Okay, good. All right.
I didn't come to you. My hips hurt. So I could dance.
And it's going to affect your back.
Okay, I'm gonna just guess. I can feel it. I can feel it. You can't expect that.
Let's hold that here at the end. Okay, good. Go ahead and sit down. There's a lot of
What you said?
Okay. So, was everybody able to see the test your neighbor and see whether their SI joint was moving or not?
Yes.
And did you see who was wearing the beautiful gray tights? Okay, because I think we tested you, and when you could see that, right? Now, all right, for 10 points, if a person does not have good balance, or I'll just tell the answer. If you're working with somebody and they do not have good balance, their sacroiliac joint is locked up. So unlocking your SI joint is crucial for eliminating low back. And when you get the SI joint moving, people will have better balance. So for 10 points, who really needs to make sure that they have an SI joint that's functioning?
All people.
What? Everybody, exactly, everybody, and especially older people who are at risk for falling, right? Okay, now, so when we sit with that retroversion of the pelvis, okay, when you sit with retroversion of the pelvis and your 5 lumbar vertebrae compressed, there's a huge amount of pressure on that sacroiliac joint, and that's going to affect your balance and your back pain and so on. All right, so I'm going to teach Deanna how to unlock her SI joint, and I'm going to demonstrate this exercise myself, and then Deanna's going to do it. So the way that we do unlock the SI joint, I'm going to teach her 2 exercises. The first exercise I'm going to teach her is called the Don technique mobilization. So I'm going to lie on my back, and I'm going to start with my knees bent. And I'm going to get
get my feet in line with my hip bones. Can you see that? So I pull my heels in towards my buttocks, in line with my hip bones. Now, I'm going to straighten one leg out. Now, one of the things we learned is that your feet control your hips. So if I have my foot relaxed, turned out like that, my hip bone is going to be rotated in the socket, which is not what I want. I want to have my foot straight up so that my hip bone's in the socket properly. So I'm going to be here. I'm going to push my knee slightly forward. I'm going to lift my butt about 1/4 of an inch, and I'm going to release. So I'm going to inhale and push it forward, and exhale and release. Inhale, push it forward, and exhale, release. Okay, and so on. Okay, so Miss Deanna, come down to the floor, sweet pie. So the first thing you've got to do with somebody with low back pain is you've got to unlock that SI joint if it's locked up. And if they have low back pain, more than likely it's going to be locked up. So I'm going to have her foot straight up like this. Okay, now push your knee into my hand. Push your knee, no, yeah. Okay, keep your heel on the ground. Okay, yeah, there you go. So push your knee forward into my hand and lower down. Good, now keep going. Inhale, push it forward, and exhale, lower down. So when I'm working with clients, usually what I'll do is I'll have her do that for 1 minute. So I'm going to use my phone, 1 minute. Okay? All right, so for those of you who just joined us, okay, and we're going to repeat after this, because I believe that repetition is the mother of learning. So repeat after me. My feet control my hips.
Control my hips.
My hips
My hips
control my knees.
control my knees.
My legs
My legs
extend the spine.
extend the spine.
Okay, so if I want to fix my hips, what do I have to fix? My feet. My feet, because the position of your feet control your hips. And we had a gentleman who asked a really good question, which was, he said when he was born like this. So if you're born in a certain position, if I'm born like this, that means my hip bones are rotated out in the socket, and then more than likely your pelvis is going to be thrust forward and you're going to be locked up right there. So, okay, good. Now we're going to do the other side. So bend this knee. Okay. Now, if I'm working with somebody with back pain, I would have them bend in both knees before. Okay, now push it forward. So this is called a Dantigny mobilization, and it's one of your handouts. I gave you 5 exercises to heal low back. Okay, so we're going to do, just for the sake of argument, we're going to do the ones on this. Believe me, I have more. So the first thing you have to do to get rid of low back pain is, from an exercise point of view, is unlock that sacroiliac joint. And there's other ones as well, but we're going to do that. Okay. So what we learned by working with Deanna, when she came in, her pain level was a 2 or a 3, but just by standing and sitting properly, then she felt no pain, right? So again, if you're working with somebody and they have back pain, then by definition, they're probably not standing or sitting properly. And again, most of you in this class do not have low back pain, but when I asked if anybody in your family had low back pain, or back pain, it was pretty much everybody raised their hand. Okay, and the hands out are over there. Okay, go ahead and stand up. Okay, and I want you to walk around, and then I want you to tell me how your lower back feels now.
Okay.
Okay, does it feel different?
Yeah, a little bit.
Okay, now we're going to retest her SI joint. Okay, so turn around. Okay, good. Okay, and before her SI joint was locked on both sides. Now, some people, their SI joint will be locked on both sides. Sometimes it'll be locked on one side or not the other. Usually when it's locked on one side, it's because the person's sitting with their legs crossed. Okay, so I'm going to be right here. Okay, lift the right knee up. Okay, did everybody see my thumbs move? You see that? Okay, and then lower down. Okay, and then lift the other knee up. Okay, can you see the thumbs move? All right, so it's a slight movement. Okay, so walk around and I want you to feel the difference. So when I'm working with somebody with back pain, just keep walking around. I use what's called the Socratic method. In other words, I could just get them to do one exercise after another, but I want their body and their mind to connect so that they see how what I have taught them has made a difference. So we only did one exercise and it unlocked her SI joint. So before, when I put my thumbs on her SI joint, there was no movement. But when your SI joint is normal and healthy and they lift one knee up, there should be, and that's too much. It's like about a half an inch. It's a slight movement, right? Okay, thank you. Right, now I'm going to teach you the next exercise. So I'm right brain. I like to teach by telling stories. A couple of years ago, I went to the doctor for my annual checkup. And I walked in, it was Monday morning, I don't know, 8:30 or 9 a.m., about this time. And I could tell, because of what I do, that the nurse who was there to help me was in terrible pain. She was shuffling along like this. And I said, does your back hurt? She said, yes. I said, may I help you? Well, she was in so much pain, she said, please. So long story short, I got the nurse to do this exercise over the, you know when you go to the doctor, they have an examining table? So I had the nurse do this one exercise for 5 minutes, and it got her completely out of pain. And the doctor gave me my visit for free. So, when somebody is in pain with their back, what is happening from a physiological perspective is that the vertebrae are compressing. Okay, so everybody knows you have vertebrae, right? And then in between the vertebrae, the nerves run. So when the nerves squish together, the nerves are being pinched. And everybody take a strand of your hair and look at it. Just look at the strand of one of your hair. Okay, just do that now. So you can even see it. Okay, your nerves are the width of a strand of hair. Okay, so think about how easy it is to pinch that. So the vertebrae compress on these tiny little nerves and it hurts. Okay, has anybody ever had nerve pain? It hurts like hell. So what you're going to do for the next exercise, this is wide leg yoga forward fold. This is a yoga pose. And so first of all, I'm going to bring my feet wide. Now how wide do your feet need to be? They need to be as wide as under the ankle. Has anybody here ever done yoga? Yes? Ish? Have you done wide leg forward fold? So there's a lot of versions. I'm going to teach you the version that I teach when I'm working with somebody with back pain. So you want to get your feet really wide and so wide that your ankles are on your wrist. You're going to do this in a minute. Then I'm going to turn my toes in like I'm pigeon-toed. Then I'm going to press down on the outside edge, pull up on the inside edge. I'm going to put my thumbs in the groin. I'm going to fold over. Here. This is what I do when I'm working with my back. So again, I'm going to get my feet under my ankles. I'm going to turn my toes in like I'm a pigeon-toed. I'm going to straighten my legs. Okay, I'm going to press down on the outside edge, pull up on the inside. I'm going to put my thumb in the groin. I'm going to fold over, and I have the person put their hands on a bed or a chair. I'm going to tilt my tailbone up. I'm going to suck my belly to the spine. My arms are as straight as possible, and I'm going to lengthen. Because I know the first thing you have to do to get rid of back pain is create length and space. So wide leg forward fold. And to come out of it, so I'm going to hold it there. She's going to hold it for about a minute. And when I'm done, I'm going to put one hand on my hip, the other hand on my other hip, lift my upper body up, and then my feet heel, toe, until I'm back in my beautiful standing posture. Okay, your turn. Okay, now, so stand with your feet super wide. Okay, now, and this is really typical because a typical beginner mistake is to not have your feet wide enough. So even though that's wide, I want you to get them even wider. Okay, now turn your toes in like you're pigeon-toed. Beautiful. Okay, great. Now, put your thumbs in your groin. Have you ever done yoga before?
A little bit.
A little bit?
One class.
Okay, one class, all right. Okay, good. All right, this is your second yoga class. So you're gonna lift and spread your chest, and then you're gonna hinge at the hips and put your hands on the chair. Okay? So just like that. Good. Now, tilt your tailbone up and suck your belly to the spine. And I'm gonna time it there for 1 minute. Okay, now, I'm gonna give you a little bit of adjustments. Now, okay, so just like that. Relax your neck, tilt your tailbone up, suck your belly to the spine. Okay, now, I want you to straighten your arms more. There, that's the pose. There should be a straight line from her tailbone all the way through her arms. Okay, so repeat after me. The first thing I need to do to get rid of back pain is to create length and space. So if somebody's got pain, then you know these tiny little nerves, the width of a strand of the hair, are being compressed. So if all you do is create that space and create space between those vertebrae, you're going to help that person get out of pain. Okay? And are you breathing?
Yes.
Okay, good. Now to come out of it, bring one hand onto one hip and the other hand onto the other hip, and then just walk around. Oh, sorry, bring your feet together. Bring your feet together and go back to your beautiful posture. Okay, so a little bit closer. So again, you're gonna, when you stand, you want to stand with your feet under your hip bones. Okay, and then from 2 inches below the belly button, the pit of the abdomen, lift that up towards the crown of the head, and then press the shoulders back into the imaginary wall. And you can see, you know how sometimes you go on Instagram and there's pictures and, you know, somebody's like this and then, I've lost 10 pounds. Well, just by standing up straight, you already look slimmer and more beautiful, right? Okay, now walk around. Okay, good. Now walk around and tell everybody, how's your back feel now?
It's good.
Feels good?
Yeah, it feels good.
Okay, good. Okay, all right. That was your second exercise. And I'm just doing the ones in the handout that I gave you. All right, now the third one that I'm going to teach you is called cat-cow. And this is really a mobilization exercise because your body's alive and your body actually needs to move. And in our culture, we sit too much. We spend too much time in the car. We spend too much time sitting and studying. Sitting and studying. So cat-cow. Easy exercise. So I'm going to come down onto my knees, okay, and I'm going to have my knees shoulder width apart, and then I'm going to put my hands directly under my shoulders, and my wrist creases are straight. So I'm going to tilt my tailbone up. Okay, this is cat pose, and then I'm going to round. This is cow. Now I'm going to move with my breath. Inhale, tilt up into cat pose. Exhale, round. And all this is going to do is just put movement into my spine. Because when you sit for hours and hours every day, you get the amount of time the average person spends sitting. Inhale and exhale. It's just putting easy, gentle movement into the spine. And a lot of people with back pain, their back is really locked up. Okay, so come down onto your knees. Okay, and have your knees shoulder width apart, and have your hands underneath your shoulders. Okay, now your knees are too wide, sweetheart. So bring your knees closer together. Okay, are you comfortable here?
I think so.
Okay, now I'm gonna beautiful hair. Have your wrist crease straight. Okay. Okay, have your wrist crease straight. Now tilt your tailbone up. Stick your butt in the air. Other way. Okay, now lift your head up as you're doing this. Good. Okay. So that cat pose. Okay, now bring your chin to the chest and round up. Okay, bring your chin to the chest, round up as much as you can. Create space. Lift up here. Lift up here. Stay there. Chin to the chest, chin to the chest. Okay, good. Now inhale, tilt your tailbone up. Go the other way. Go back to cat pose. Lift your head up. And then exhale, chin to the chest, round into cow. So I'm just teaching you all real simple little exercises. Keep going. back and forth. Move with your breath. Inhale as you lift, and exhale as you round. Good, keep going. So I've taught yoga, this is my 21st year teaching yoga. I just turned 58 years old. I know that's like, I'm an old person. According to you guys. When I was your age, I used to think anybody over 30 was ancient. Anyway, so when you're working with people with back pain, you want to teach them how they can move comfortably and just get some movement into the spine. So cat-cow is a real good way to do that. All right, now the next thing, she's going to keep going and I'm going to talk. The next thing that I always do with people with back pain is teach them how to stretch their hamstrings. And I'm going to show you all several ways to stretch your hamstrings. Does everybody own a bathrobe? Everybody have a bathrobe? A bathrobe? Okay, good. Deanna, did I walk around? Okay, and tell us how you feel now.
I feel better.
Feel better?
Yeah.
Good. All right, okay, now I'm going to show you several ways to stretch your hamstrings. All right, now the first way is with a yoga strap. Now a lot of people go, well, I don't own a yoga strap or I can't afford a yoga strap. This is probably about $8 on Amazon. I like the one with the plastic buckle because I do other cool things. All right, so with this, I like the ones with the plastic buckle better than the metal buckle. So I'm going to be here. When you're working with somebody with back pain, when you have them transition, always start with their knees bent. Okay, because if you have their legs straight, it's going to jam up their lower back. So I'm going to be here, and I'm going to put a strap on the ball of the foot. Okay, and I'm going to have the other leg straight. Now notice this leg is as important as this leg because, again, whatever my foot is doing is whatever my hip is doing. And when you do your yoga, you want to use your yoga to put your body back into alignment. Now I'm going to hold it evenly on the two sides of the strap. I'm going to keep my leg straight. I'm going to draw from my kneecap towards my hip. And I'm here. Now this is one way to stretch your hamstrings, okay? The way that a lot of people do it incorrectly is they bend their knee. The hamstrings are very tight muscle for most people. It's more like a tendon than a muscle. It's very fibrous. So I'm going to show you the way I like to teach people when they've got really bad back pain. But first I'm going to have her do this, okay? So I'm going to talk a little bit. So come down onto the floor. So if you're working with somebody with back pain, then 99.9% of the time, their hamstrings are going to be too tight. So if the back of your leg is tight, it's going to pull on your lower back. So straighten this leg up in here. Okay, and then I'm going to put the strap on the ball of the foot, and then reach your hands up like that. Okay, very good. Now straighten this leg out right here, and have that toe straight up to the ceiling. So just like that. Now don't bend the knee. Again, because most people are going to have tight hamstrings, it's more important that you lower the leg to where that leg can be straight. And then I want you to tighten the quadricep. Beautiful. Now there's a concept called reciprocal inhibition. So repeat after me. Reciprocal inhibition.
Reciprocal inhibition.
When the front of the body contracts,
The
back of the body relaxes.
back of the body relaxes.
Okay? So just by tightening her quadriceps, she gets more stretch in her hamstrings. You feel that? Yeah. Okay? Because a lot of people think, oh good, now I can just, do nothing. All right, so you're going to be there for a minute, and then I'm going to be looking, what I really like to do when I have people with really tight hamstrings is I like to find a wall. So I'm going to rearrange some furniture here so I can demonstrate this next one, because most people with back pain, their hamstrings are really ridiculously tight, and they need to do something that I'm about to show you, because when they just use the straps, you can use straps, but they usually do it incorrectly in their hand, and they're so tight, they've got to do it so long that their hands get tired. Now, a lot of people, when you stretch, they just stretch for 5 breaths. when I teach yoga and I'm using it in a therapeutic way, I have everybody hold the poses at least 60 seconds. Because you've got to hold it long enough that it breaks through the muscles and the connective tissue. So this is very important also for you all to learn. Okay, so bend your knees. Bend your knees. Okay, and bend this knee, bend this knee. Start, always transition with knees bent. Okay, good. Okay, good. Straighten that leg out. Good. I'm going to make sure her foot is straight up. And see, even here, she wants to bend the knee. So here, and there. She's learning. She's a smart girl. Okay, so where was I? So whenever you have an injury, if you have any kind of injury, the muscles and the connective tissue stay sort of fluid for about 6 months. So remember this, if you ever have an injury, whether you have a car wreck or you rip a tendon or there's any kind of injury that you have, in that first 6 months, you want to get some body work done. Chiropractic, massage, this kind of yoga, because you want to work with the connective tissue and the muscles while it's still fluid before it hardens up. Most people who have injuries, the connective tissue, which is called your fascia, which is the web of connective tissue throughout your body, has really hardened up. So when I'm working with people therapeutically, I have them hold the poses long enough that it can break through that tough connective tissue to make a difference. Okay, good. Bend your knees. Okay, and then get up, walk around, and tell us how you feel. And then while she's walking around and telling us how you feel, I'm preparing, and I'm going to show you the next one. So when I'm working with people who have back pain, good. Now when you stretch your hamstrings, you're able to stand up straighter. Feel that? Feel a little taller?
Yeah.
Okay, now this is how I work with people who are in pain. Because one of the tricks to working with people in pain, they're usually afraid to move. You've got to make it easy. So I'm going to teach you one leg against the wall. So what I'm going to do, I'm going to find a wall. I'm going to pretend that's a wall. I'm going to come down onto the floor. I'm going to get my butt on the wall. Then I put one leg straight up. Fortunately, I'm not moving stuff. I'm not very tall. This leg hugs the wall, and this leg is straight up. And the more I drive my heel into the wall and draw from my kneecap here, again, I'm lengthening the back of my leg, just like this. And I'll have people hold this for 5 minutes each side when they're in back pain or hip pain. I use this for hip pain or back pain. So first of all, when they do this, okay, you go over here and do it. That is called one leg against the wall pose. It's the easiest way to stretch tight hamstrings. And if we had more walls, I'd let everybody feel that. Okay, so she's here. And then get that other foot straight up. Yes, and hug the wall. Good, hug the wall, okay? Yeah, just like that, all right? Your foot straight. Your foot wants to turn out, so just like that. All right, so now, all right, good. We're going to have her do that for 1 minute on each side. Again, if I was working with her at home, I'd have her do it 5 minutes each side. So what this does, by having the one leg against the wall, it allows your nervous system to go parasympathetic. You have two sides of your nervous system, the sympathetic and the parasympathetic. The parasympathetic side of your nervous system is the side that lets you just relax. And when you relax, your muscles soften, okay? So again, that hamstring is usually really tight and it's overly contracted. So by putting the person in a relaxed state, don't you feel relaxed?
A little.
Okay, it just hurts, yeah. Well, your hamstrings are too tight,
Yeah.
right? But isn't this easier than using the strap?
Yeah.
It's easier. And your hands don't get tired. So by doing it this way, she can do it long enough that it makes a difference, okay? Because when I'm working with people therapeutically, okay, now bend your knees and roll to your right, okay? and just so that she's not warped, we're gonna have her do it the other way. Okay, so, you come up, and how do you do it the other way? I'm just gonna move the yoga mat this way. And even though you're the demo model, we still don't want you to be warped. If you could, now, get your butt up, and then your other leg's gonna go this way. So that hamstring muscle is more like a tendon, and it tends to be very tight. And so you've gotta, the other thing about working with what I call actual humans is you've gotta make their program easy and enjoyable enough that they'll actually do it. Right? I mean, couldn't you just do that?
Yeah.
If I even gave you one exercise, you'd be, hey, I can do that. Right?
Yeah.
Like that. I can do that. All right, so that's your one piece of homework. You can do the whole thing, right? Although you really need to, well, unlike the rest of it, you need the whole thing, but no. All right, so that's the easiest way to stretch tight hamstrings. Does anybody, would you be willing for them to take your picture?
Sure.
Okay, does anybody want to take a picture of that?
No.
No, y'all can remember. Do you have a question?
Yeah, with the strap, isn't it for her top, the top of her foot down?
What's that?
Like, isn't the strap for her foot down, like the top part?
Yes.
So how would that be doing that right there?
Because what we're really doing is lengthening the hamstring, and here by driving her heel into the wall and contracting here, it's creating length in that hamstring.
Like most of my tightness.
Yeah, in other words, I'm gonna move your leg. It's the strap is pulling her foot towards the base. Okay, good. Now bend your knees and roll over to the right side. Okay. Okay, and good. Walk around. Okay. And how do you feel now? Loose? Feels good, doesn't it? Okay. All right. Okay. Now the next thing, I'm gonna demonstrate this. Okay. So we talked about how if your lumbar curve is less than 30 degrees, then the discs are going to compress. Okay. And again, I know women. I have an ass. And so a lot of times you're looking at this. Well, most people with low back pain, their lumbar vertebrae, their lumbar curve is too flat. It's less than 30 degrees. The next thing that goes on with back pain is kyphosis, AKA slumping. Okay, which we do a lot when we're sitting, slumping. So this next exercise helps us, it's an anti-slumping exercise. So what I'm going to do, just, I'm going to put the eggs on the ground like this, creating space, okay, and your vertebrae are going to go there, and then let me have your yoga egg. Okay, good. This is going to be my pillow. You'll have to give these back, by the way, because this is what I use in my yoga class. So what I'm going to do is I'm going to lie over the yoga eggs. This is a pose